Welcome, everyone. Welcome to a beautiful session like Eat to Beat Heart Disease. And since February is the Heart Health Month, and this topic could not be more apt for this month. So it's so wonderful to see you all. So welcome everyone. For those of you who are meeting me for the very first time, I'm Dr. Shobha Rayapudi. I am co-founder of Gift of Health and also a board certified lifestyle medicine doctor, where I actually help people struggling with heart disease, high blood pressure, cholesterol, diabetes, and other common chronic conditions that we see nowadays to actually break free from those diseases, reduce your dependency on medications, and have more energy. So it's quite a pleasure to host this session today. Like as I said, February is the Heart Health Month, and it is so important to know about our heart. And guess what? Even Valentine's is coming, right? So Valentine is the time like where we want to express our love, express our heart to our like precious members and all that to our sweethearts and everyone, right? So um, I, like I wish a very happy Valentine's Day for this weekend. And so like what we are going to do is, as I said, like tomorrow, like I'm going to touch upon a very important topic. Like heart disease is the number one killer. If you look at the Western civilization, it's the number one killers. Like if you take all the deaths that happen due to cancer, heart disease alone causes more deaths, even like when you compare like all the deaths that are happening due to cancer. So that's how crucial. And many of you would also realize that heart disease, it doesn't strike us until it has happened to someone in our family member or to us. Until that time point, we are just thinking, oh, this is something that's not going to happen to us, or maybe this is something that is going to happen as we age, right? But once that heart disease strikes, then we keep wondering, like we are so afraid and wonder like what to do, and there is not much information available there. Like we are so confused and even afraid, like what is the best step for me to take, what is the best step to take so that I don't get the next heart attack, what is the best step that I can take that like I can prevent heart attack, can I make myself heart attack proof? These are all the lingering questions that people have, and that is what like I want to address today. So this is a very valuable session, so feel free to share with your friends, family members, so that they can tune in. And we are actually conducting this in the Zoom session. So like if you are watching live, I would highly recommend to jump into the Zoom session, because like you will be able to ask questions, and like when we will be dropping some resources, you will be able to grab those resources and do all that fun stuff, right? So if you are in the YouTube, like we are going to put the link to join for our Zoom, and you're welcome to join there. Okay, so with that, let us get started. And I'm so excited for people who are already here with us. So welcome everyone. And let us get started. Okay. So I just want to start off with one question. Okay. Like, uh, do you guys know, I just want to make sure that like you guys are able to see the screen, right?
It's good.
Okay, so okay, excellent. Okay, okay. So, do you know what is your risk of heart disease? Like if a person has high blood pressure, they have 3 times the risk of having heart disease or stroke. If a person has diabetes, they have 4 times the risk of having heart disease. And if a person has high cholesterol, they have 4 times the risk of getting heart disease. But guess what? If people have all these conditions, if people are having high blood pressure, diabetes, high cholesterol, it's 40 times more risk than the regular person. You have 40 times more chance of getting heart disease when compared to a regular person who's not experiencing this condition. And this surprises a lot of people. So again, like you might be wondering, okay, maybe this is not a good, I mean, that great of a deal. But if you really look at the state of our affairs, if we look at the number of people experiencing chronic disease in Canada and US, especially the Western population, 6 out of 10 people are having that chronic diseases. And guess what? 4 out of 10 people actually have 2 or more chronic diseases, not only one, but 2 or more. And half of the Americans have cardiovascular diseases. So, like almost 5 out of 10 people have cardiovascular diseases. And when it comes to pre-diabetes, 1 in 3 people have pre-diabetes, and almost like 72%. I mean, that percentage has gone up. It's almost 75%. So, almost 3/4 of the people are overweight or obese. That's the state of affairs. Okay, so literally, like if you look at it, like every hour someone is going to their physician with either with high blood pressure or high cholesterol or diabetes. And guess what happens when you go with these conditions? You're put on medications, but they're generally never told that changing their diets could get rid of their problems and even save their lives. How many times do you hear from your doctor that, like, when you change your diet, you will be able to take care of this condition, versus how many times you get a prescription out? Because, yes, like we all recognize, the doctors recognize these are the dangerous conditions to have, because as you can see, like if you have these conditions, your risk of heart disease, like almost 40 times. If you have high blood pressure, diabetes, high cholesterol, you have 40 times the risk of getting heart disease. It is actually killing more number of people. But when you look at the risk factor for heart disease, so here, like uh, this blue line, so I just want to, okay, so you see this blue line. So this is deaths due to cardiovascular diseases. And if you look at it, dietary risk. So diet is the number one risk factor for cardiovascular diseases or death due to cardiovascular diseases. So if you see, like actually heart disease kills many people prematurely, and most of them do not even make to the hospital alive. And like have you guys noticed that? Like, and if you look at it, 55% of people who are experiencing the heart attack for the very first time, so 55% of males, and if you're a woman, 68% of women who have sudden cardiac death actually have no prior warnings of significant heart disease. And unfortunately, now we have been witnessing this in people in their 30s and 40s. And what you notice is a person actually dies very immediately after the symptoms begin. And very few of us are actually fortunate to survive the attack. Right? So, like, even though this is the number one killer, as I said, the gravity of this problem doesn't hit us until it happens to us or to our loved ones. Okay. So, as I said, when you go to your doctor, like you are usually prescribed a pill, but not many people counsel you on diet or nutrition. So, if you look at it, chronic diseases are the leading cause of death and disability. So Lifestyle medicine is a field. It's actually a medical specialty. Not many people are familiar with this, so that's why I'm stressing here. Like lifestyle medicine is a specialty that actually uses evidence-based whole person prescriptive lifestyle change as a primary modality to treat, and when used intensively often can reverse such conditions such as heart disease. So your heart disease can be reversed when you make a diet and lifestyle change. And doctors who prescribe diet and lifestyle change are the lifestyle medicine doctors. So you might be wondering, okay, like where can I find lifestyle medicine doctors? So I'm a board certified lifestyle medicine doctors. So like me, there are thousands of board certified lifestyle medicine doctors out there who are trained to effectively counsel patients and use food as medicine program that we use just like us. Okay, you can actually go to multiple sites such as American College of Lifestyle Medicine or Plant-Based Doctors or Plantation Project, and you can actually find a lifestyle medicine doctor near you. So you can actually search for and go to a lifestyle medicine doctor when you are actually diagnosed with these conditions. Certainly, all doctors who are caring for adults should be making an effort to inform their patients of this very crucial information that nutrition excellence or diet can actually reverse this. But what happens is very often doctors believe that dietary modifications are simply too difficult for the patients to follow, and they don't advise their patients. Even though they recognize that the conventional approach is not ideal, but they rationalize their treatment choice by telling themselves that patients won't change their diet and lifestyle. But this is not the case like when you visit a lifestyle medicine doctor. Okay, so here, um, what are the conventional treatments? So like so whenever you're diagnosed with heart disease, what are the conventional treatment? Either they ask you to go for the coronary artery bypass surgery, or they ask you that like stents be put in your blocked arteries. But even before we go to the treatment, first let us understand how heart disease happens, because this is very crucial. Once you understand this, then maybe you will be able to take the steps. Okay, so if you see this, this is how like on the upper right corner, this is a normal artery. Okay, this is a healthy normal artery, and what you're seeing here is uh, a plaque deposition, so which we call as atherosclerosis. Atherosclerosis is nothing but the buildup of cholesterol-laden fatty plaque in the interior of the blood vessel. So basically, when there is excess cholesterol in the blood, it irritates your arteries. Your When there is excess LDL floating in your blood, what happens? Your endothelium becomes sticky, your LDL becomes sticky, your platelets become sticky, and they stick to the wall. And when this cholesterol sticks to the wall, like what happens? So sometimes if it is sitting on the wall, it calls for a reaction. So if this LDL particles, they get inside the inner lining of your blood vessel, which is the endothelium. So if the LDL gets inside, what happens? That becomes oxidized, and it calls for inflammatory reactions. Typically, like you can just imagine like a SWAT team. So maybe I'll just explain further in the next slide. So like if you okay, but before that, but typically, like when you get angiogram, or when your doctor finds that your heart vessels, 90% of your heart vessels are blocked, what do they tell you? They tell you that you need to go for stenting, or either you have to get your coronary artery bypass. So, and first, what they do, they put you on statins. And then when they put you on statins, you slowly begin to notice that in 2 months, you're experiencing memory loss. Then you slowly begin to notice that you're getting muscle pain. Then you slowly notice that it is also causing increased appetite, you're gaining weight, you're developing insulin resistance and diabetes. And then your doctor also tells you that they need to monitor your liver function test because statins affect your liver. So as you can see, like even when you're put on medications, there are so many side effects for this medications. But if you make the diet and lifestyle change, you can achieve similar results without the drawback. So you can actually reverse your disease without any side effects of the medication. So if you look at it, this is how a normal artery looks like. And if you look at the inner lining, so this is your inner lining of the endothelium. The blood comes in contact with the inner lining of your endothelium. And just to explain how the plaque forms, so if you look at this, so just to orient yourself, so the blue thing is where the blood is flowing, and you see this purple thing, this are your endothelium. Okay, so these are your inner lining of your blood vessel, the endothelium, and you see these yellow particles, they are your LDL, bad cholesterol. So when this LDL becomes sticky, they stick to the endothelium, okay? And slowly you can see that they are getting inside your endothelium, inside the artery. And when they get inside, what happens is they oxidize because your muscle cell doesn't like to have the fat cells inside. So what it does is it oxidizes. So you see this yellow thing? What happens here is it oxidized. And once the oxidized cholesterol is present inside, your body calls for a SWAT team. You see this blue macrophages, so they come in and they just gobble up this oxidized LDL. Just like Pac-Man, they just gobble up. And once they gobble up, this same thing becomes into a foam cell. And foam cell is a very nasty thing because once the foam cells develop, what they do is they release a lot of chemicals that actually calls for a clot formation reaction. Okay, so if you see, like on the left hand side, like what you're seeing, like you're seeing a clogged blood vessel. Okay, so you might be thinking, oh, this is such a nasty blood vessel, maybe this is going to cause heart attack. That's what most people think. And on the right also you're seeing a blood vessel, so which is partially, so you're able to see this plaque, right? So here, which do you think is the stable plaque? The one on the left-hand side or one on the right-hand side? Okay, or let me ask you this way. Which plaque is going to cause the heart attack? Any guesses? Okay. I see someone saying that the one on the right, that it is going to cause the heart attack. Okay. And I see some saying the one on the left is going to cause the heart attack. So you see this nasty a blood vessel. You might be thinking that this is the one that is going to cause heart attack, but guess what? This is a stable plaque. Okay, because for example, so let's say when the plaque develops, so like here, like as you can see, okay, let me go back to this one. So as you can see, once a plaque develops, so this plaque can be a stable plaque or it could be an unstable plaque. So here on the left hand side, so when the plaques become hard and stable, they become stable. So actually most heart attacks don't happen here because the most stable plaques, they just narrow and there is limited blood flow to the heart muscle. Whereas if you look at this plaque, you see like how thin the cap is. And once the foam cells form, they actually thin the fibrous cap. And once the fibrous cap thins away, so I mean, just to show you. So this one, like once the fibrous cap thins away, so the contents of the plaque actually spill into the blood. And this calls for a reaction. This calls the platelets. And like you can see this red one, this is nothing but the clot formation. And and slowly when the contents spill, there is a larger clot formation. And you can see like here, this whole clot is blocking the blood vessel. And this blockage of the blood vessel actually completely cuts off the blood supply to the heart muscle, and this is when heart attack happens. This is when the muscle dies. Okay, so I mean, just to so if you can see, these unstable plaques are thin and inflamed, and they are more likely to burst and cause a heart attack. So most heart attacks are actually like 90% of the heart attacks are mostly caused by a clot that forms within the blood vessels and enlarges to extent that it obstructs the blood flow. Okay. And clots are prone to form in areas where the plaque is very thin. So you can see the plaque here is very thin and calcified. That is more vulnerable to cracking, as opposed to the plaque here is so thick that even when the blood is flowing through it, the plaque doesn't rupture because it is so thick. So just to show you the difference, so on the left hand side is the vulnerable plaque. Okay, and the chance of the plaque rupturing depends upon two important criteria. Okay, so one is how much of the fibrous cap is present. What is the strength of the fibrous cap? So when I say the fibrous cap, you see this one? So this is the fibrous cap of the plaque, and this is the base of the cap. Okay, so I just want to orient you guys. So here, like if you see, so it depends upon, like one is the strength of the fibrous cap and the amount of white blood cell or the amount of inflammation that is present. And so this, like this are the two things that actually cause the rupture. So on the left-hand side, you see a stable plaque. And what are the characteristics of stable plaque? So what you would notice is in um, in the stable plaque, you are able to see like the fiber. Okay, so on the right hand, okay, let me first let me ask you, of this two, which one do you think is the stable plaque and which one do you think is the unstable plaque? Can you guys guess? Can you guys guess which one is the stable plaque? Uh, this is on the left. Is this the stable plaque or is this the stable plaque? Okay, so I see that the one on the right is stable. Okay, so Anne is saying the one on the right is stable. Okay, so if you look at it, the one on the left, which is most vulnerable, what you would see is the lipid segment. So you see this lipid segment, okay? There is substantial lipid segment, and the lipid segment is infiltrated. You see this inflammatory cells, it's infiltrated, especially with macrophages. And what you notice is the fibrous cap is thin. There is significant tensile stress at the edge of the plaque. Okay, so like there, so what, like the lumen is where the blood is flowing. Okay, so what you would, so you see the tensile strength. So when the blood is flowing here, so there is significant stress that can happen here. Whereas if you look at the right hand side, you see a thick fibrous cap. Do you see that? And you see that there is a lot of smooth muscle inside it. And there is not significant stress. So even when the blood is flowing through the lumen, there is not significant stress on the uh, uh, there's not significant stress on the base of the plaque, neither on the cap of the plaque. There is not significant stress. So how can you make an unstable plaque to stable? That's the key, because once you know, this is your key to making yourself heart attack proof. Once you know how to make the plaque stable. So what do you think can cause the plaque stable? Any guesses? What is one thing that can stabilize the base of the plaque? Okay, I see exercise. Any other guesses? Diet. Okay. So I see exercise, oil, diet. Okay. So you guys got it. Actually, superior nutrition stabilizes both the base of the plaque. So it stabilizes the base, and it also stabilizes the cap to keep it from cracking. Because what is important is you don't want the plaque to rupture, because once the plaque ruptures, that's when the heart attack is happening, right? So you don't want to have that. So I see some questions here. Okay, I have a family history of heart disease. My cholesterol and triglycerides have been increasing since I was 50. I'm 54 now, and my physician would like me to start taking statins. Instead of starting statins, will hormone replacement therapy help lower cholesterol and triglycerides? Hoping to start hormone replacement therapy soon. Okay, so one is like, as you guys can see, like when it comes to heart attacks, when it comes to lowering your cholesterol and triglyceride, what is the number one thing that is actually going to help you? It's the diet, it's the food. When you change your diet and food, you would be amazed to see the changes. And a lot of people like who come to our 6-week food as medicine class, they are surprised to see that, like when they change their eating habits, even though they had history of heart disease, they're able to see that their cholesterol is coming down, their blood pressure is coming down. So the best bet is making diet and lifestyle changes. Okay, instead of just going for the hormone replacement therapy. So the other question was for high triglycerides, what foods and amounts are recommended to eat? Already have removed oil and sugar. Salt has been harder. I don't cook with it, but do add it at the table or use miso or coconut aminos. I understand that we should stop eating when satisfied, but I'm not there yet. So what is that I can do? So I will be addressing that question further down the presentation. So just hold on to that question for now. And the other question is it just time that determines whether LDL crosses over into the vessel wall? So that's another excellent question. Okay, so here, uh, it, more than the time, like what when does the LDL crosses is when it is sticking. Okay, as long as the LDL is floating in the blood, nothing is happening. But like as your cholesterol levels go up, but even before that, and I'm so glad you asked this question because this is the key. So when your blood becomes sticky, that's when the LDL sticks to your inner lining of the endothelium, inner lining of your blood vessels. Okay. And if you don't want the blood to become thick and sticky, what do you need to do? You just need to change the biochemistry of your blood. So your blood can flow thin like a vinegar consistency, or it can flow thick like ketchup. So when you eat certain foods, your blood becomes thick like ketchup. And when you eat certain foods, your blood becomes thin like vinegar. Can you guys guess which foods can make your blood thin like vinegar versus which foods can make your blood thick like ketchup? Can you guys guess? Okay, so I see some of you saying meat and animal-based foods. Yes. So when you eat animal-based foods, your blood becomes thick like ketchup. And when you eat plant-based foods, or especially when you eat those leafy greens, your blood become thin vinegar-like consistency. And sometimes, even though you have LDL in your blood, Angie, what happens is the LDL sticks when your blood is thick in consistency. Okay, so that's the difference. It's not even like how long, like it's not even the time, like whether with time that it will cross, but the most important thing is uh, when we are eating, whether is it making our blood thin in consistency or thick in consistency. Okay, I hope that answered your question. Okay, so coming to okay, so coming to like how we can make our plaque stable or whenever our plaque are unstable. This is very crucial to understand because many people uh, even after they have experienced heart attack or heart disease, they don't understand what is that they need to do to prevent the next heart attack. What can I do? Because only when you stabilize your plaques, you're not going to get your next heart attack. When you know how to stabilize your plaque, that is the key. And a lot of people ask me, okay, so let's say if I have blockages in my arteries, can I reverse those blockages? This is the common question I get, and let me tell you. So let me show you. This on the left is the angiogram, so which looks at the blockages of the blood vessels. And as you can see on the left hand side is the angiogram. Like this is like hopefully like you don't want to see uh, such nasty angiograms, right? So here you're seeing the image of a Cleveland Clinic surgeon, and this is a diseased distal left anterior descending artery, which is the main blood vessel supplying the blood to the heart. Okay. And what happened is the surgeon in this case, who was the patient, could not be stented because the diseased artery was anatomically too extended. I mean, like it was not available for stenting, and he could not tolerate statins. So he was just left with the choice of changing his diet. He had no lipid lowering medications. And now look on the right, you can see this is just by eating whole food plant-based diet, like how his arteries have improved. Are you guys able to see the difference from the left to the right? And guess what? How much time did it took? Just in 32 months, without using any statins, without using any cholesterol lowering medications, without getting any procedure, this was improved artery. Uh, but let me tell you, so many people might be wondering, oh, does it take that long? You can actually see the improvement within weeks when you change your diet. Okay. And this is the beauty. I mean, your body has such an ability to heal, and this is something that you can provide to your body. But unfortunately, not many doctors counsel their patients about this. But instead, like, what do they tell? That, oh, we need to stent you, or we need to perform the bypass surgery next week itself, so that like you don't get the heart attack, right? So many people get that diagnosis and wonder like, what is that I can do? One thing is, do you think like bypass surgery? So let me show you this one. Okay. So do you think putting a stent or bypass surgery could prevent the next heart attack? So let's say like if you have plaque formation in other arteries, so when they do bypass surgery in the main vessel of the heart, do you think it is going to prevent the next heart attack? Do you think that procedure is going to prevent the next heart attack? No, because as you can see, when does heart attack happen? When this soft plaque, when this unstable plaque ruptures, that's when the heart attacks happen, right? So your coronary bypass surgery is not able to prevent the future heart attack. That's one thing. And are there any risk to coronary bypass surgery? Oh my God, it is so expensive. And one of the risk factor is right after coronary bypass surgery, like usually when they clamp the arteries, some of the clots they can travel up and cause stroke. That is the most common side effect that you would notice. Okay, so here, like, so what is the solution? Changing your diet. And as I said, how can you make your plaque stable? By providing superior nutrition. Okay. And when I say nutrition, there is a lot of confusion. Okay. So let me tell you, like when it comes to nutrients, you need to get both the macro and the micronutrients. We focus so much on the macro. We focus on the protein. We want to avoid the carbohydrates. We want to avoid the fats. But like what you need to know is like when it comes to food, it gives you two things. It provides you with the energy. So that energy comes when you're consuming fats, proteins, carbohydrates. And it also provides you with the micronutrients. Okay. When you consume the vitamins, minerals, phytochemicals, and fiber. And these micronutrients are very essential. So, for example, like if I take a whole grain, for example, so when you look at whole grain, it has both the macro and micronutrients. So, the external covering of this rice grain has bran, which has vitamins, minerals, phytochemicals, fiber, and the inside is called the endosperm and starch, which is mostly stored carbohydrate. And the germ again has phytochemicals, unsaturated fats, vitamin, minerals. And if I sow this grain in the soil, it can become into a plant. Why? Because it has all the essential nutrients to develop that. But let's say if I take the outer covering, okay? If I take the outer covering of this grain, so I'm losing the vitamins, minerals. If I'm taking the germ, I'm losing all that vitamins and minerals. And what am I left with is a processed grain. Example of processed grain is white rice. Okay, so brown rice is the whole grain, and when you take out the bran and polish it, like you get the processed grain. So are there any nutrients in this processed grain? Are you guys seeing any nutrients in the processed grain? No. And when you make foods out of this processed grain, whether it is noodles, Rice Krispies, or white rice, do you think you're getting any nutrition over here? Are you getting any micronutrients? The same thing with the wheat. So when you process the wheat, do you think there are any nutrients? So when you look at these examples of white bread, baguette, pasta, especially white noodles, bagels, cookies, breads, muffins, tortillas, your cereals like Cocoa Puffs, Fruit Loops, croissants, donuts, do you think they have nutrition in it? No. But and a lot of people, what they do is they try to diet. thinking that diet is going to help them lose weight. But constant dieting, if it's not providing you enough nutrients, your body will not be able to heal. So if you want to know the nutritional excellence of the food, that food must contain both the macronutrients and the micronutrients. Okay. So technically, like what they do is they categorize the food based on the highest nutrient available per calorie. And that one, we call that as an Andy score. Okay. Because especially the micronutrients, our body cannot produce those micronutrients, and we need to consume food to get those micronutrients. So when you're eating a food, you want to see what is the score of the food in terms of the macronutrient and micronutrient ratio, and that is known as the Andy score. So you guys might be wondering, what are the best food? What are the nutrient-rich food that I can eat to get the maximum nutrition? So this is a table which is showing the foods. These are all the examples of the food, and they are scored by the nutrition level. Do you see here something? Collard greens, kale, mustard greens, Swiss chard, all the greens, they have the highest score, which means they provide you with maximum nutrients per calorie. That is how important it is. Similarly, like if you go down the list, so like if you look at each food group, like you are able to see their nutritional score, right? And like if we come to the next table, how much nutritional value cola has? 1. Compared to how much nutritional greens have? 1,000. That's the difference. So like when it comes to, and then like what, apple pie, it's 4. Bagel, corn chips. So do you, and white rice, see the nutrition score is 8. Compared to like when you eat the brown rice, so that is going to increase your nutritional excellence. Okay, so like if you look at this table, like you are able to see this. Like you guys are welcome to take a picture of this, so that like when you're buying foods, you are aware that like you want to eat the foods that are high in score. Okay. And then the other thing is, not only we eat nutritionally deficient food, we also eat foods laden with saturated fats. Okay, so if and most people are also confused about fats, because when it comes to fats, there are 3 different types of fats: trans fatty acids, saturated fatty acids, and unsaturated fatty acids. So unsaturated fatty acids can be again divided into monounsaturated fatty acids and polyunsaturated fatty acids. So polyunsaturated fatty acids are called as essential. You might have heard of omega-3s and omega-6, right? They are essential because your body cannot produce them. But monounsaturated fatty acids are considered non-essential because they can be produced in the body. And these are examples of saturated fatty acids. And sometimes people ask me, okay, I am limiting my saturated fat intake. So what is that I can do to prevent heart attack? So they think that, okay, I'm buying skim milk, I'm eating lean chicken, and I'm taking olive oil, so that it is less in saturated fat. But let me tell you guys, when it comes to saturated fat, 65% of the fat that is present in milk is in the form of saturated fat. 50% of fat that is present in beef fat is in the form of saturated fat. And 30% of this fat that is present is in the chicken is in form of saturated fat. And guess what? 14% of the fat that is present in olive oil is saturated fat. So the other 86% of the fat present in the olive oil doesn't raise your cholesterol level, but this 14% raises your cholesterol level. So And why are we so particular about saturated fat? Because it is directly associated with increasing inflammation, it alters your gut microbiome, and indirectly it increases your LDL cholesterol, plaque buildup, it decreases blood flow to the kidney, and it increases your cardiovascular risk. And these are few examples of trans fatty acids. And so when you're having that cakes, cookies, chocolate-filled candies, donuts, croissants, what is happening? Your trans fatty acids are going up. And I think I had one question about the trans fatty acids. So and I know like even, so let me go back to that question. Okay, so Sharon is asking, is 65 a good score? So again, Sharon, so it's 65 a good score compared to what? Obviously, it's a good score compared to 1. Obviously, it is good score compared to 1 or 5. Versus, it's not that of a good score when compared to 1,000. You see the difference? So it's not only you're seeing the numbers. So like let me go back. So here you're not only seeing the numbers, but that 60, whenever you're saying that 65, like compared to what? Okay, this 65 is definitely better than the foods that are scoring in this range. That's our scoring in 20s and 1s and 5s, right? You see the difference? But obviously, when it comes to the greens, when you eat the highest scoring things, that's the winner. Okay. Um, so based on what amount is this chart? And can you clarify your question? Like, are you asking like based on what did they score the numbering? Is that what your question is?
Yes, amounts, like how much collard green to eat 1,000 worth.
Oh, you okay, so that's a different question. So here the score is indicating like how much nutrients is present. But like if your question is how much collard greens should I be eating to get that score, right? Is that was what your question. So eating at least when it comes to heart disease, it's recommended having at least 6 servings of greens. But even if you're starting off with like 1 or 2 servings of greens per day, that's I mean that's a game changer. Rather than not eating any greens per day, eating at least 1 to 2 cups of greens and building yourself up to that 6 servings of greens is the key. Yes, you can definitely buy frozen collard greens, but here I know like collard is listed in the list in the beginning. But it's same thing with kale. If you kale or mustard greens. So like all these greens have a score of 1,000. Are green peas good? Yes. So like in this like in this chart, like you can go. So look, so here green peas, it's giving you a score of 63. Okay, so does putting it in smoothies good too? Yes, and when you're starting, uh, at least consuming in the form of smoothie is better than not having at all. But as you are able to consume more, you want to get away from just consuming in the form of smoothies because you want to chew your greens. So chewing your greens gives more nitric oxide release. So it's always better to chew your greens. Okay. And okay, so when it comes to triglyceride, what foods and amounts are recommended to eat? So when you're eating greens, okay, so when you're eating greens and especially foods high in nutrient value, what you would notice is your triglyceride levels are coming down. So focus on foods with high nutrient value. Go for unprocessed food. Go for totally unprocessed food, whole food, and you will notice that your triglycerides are improving. And are canned fruits okay? Okay, so again, like when it comes to canned fruits, you like they're definitely better to eat rather than not having any fruit. And again, when you're buying the canned fruits, make sure they're not sweetened. Okay, sometimes they add sugar syrup to the canned fruits, so you want to go for unsweetened one, or the fruits that are just in plain water. Okay, so Beverly is saying, I usually eat berries with Greek yogurt with pumpkin and sunflower seeds for breakfast. I would really like to cut out yogurt. I enjoy something sweet with my coffee in the morning. What can I eat instead? So this is amazing, guys, because as I said, like we really want to help you transition to that, right? So, Beverly, I'm coming to that question because here, as you can see, like when it comes to saturated fat, it's so surprising. Look at the amount of saturated fat present in 1 cup of coconut, in just 1 tablespoon of coconut oil. So, even according to the health guidelines. So, Vanessa, if you can post the document in the chat. So, I'm giving you guys one document like what are the healthy fats to eat, to foods that protect your fats that protect your heart. So Vanessa is going to drop that document in the chat and you guys can grab it. And it also talks about the essential fatty acids and everything. What you need is the polyunsaturated fat, not the saturated fat. You want to eat the foods that are rich in polyunsaturated fat and low in saturated fat. And these are examples of all the foods with as you can see, like this are if you look at like beans, lentils, chickpeas, they're so low in saturated fat, right? Just 0.1. Like if you look at tofu, 0.7, sunflower just 1, and look at the polyunsaturated fatty acids in sunflower seeds, it's 9. Tofu, it is like a 1.2, and when you look at walnuts, it's 10.8. So when you eat the nuts and seeds, they provide you with healthy fats. Okay, and that's what like you want to eat. Like I have provided a free document for you guys to download, and that is something that you can read after the session. But right now, coming back to Beverly's question, because this is so important. How do we do that? Because it is so confusing, right? Like, okay, how can I eat healthy fats? So here, can you take us all to the supermarket? Yeah, but guess what, Sharon? What we are doing is we are doing a 5-day challenge, because in this 5-day challenge, I want to show you guys how can you swap the unhealthy unsaturated fats, sorry, swap the unhealthy saturated fats with the healthy fats, or the polyunsaturated fats, so that like you're preventing. And also, how can you eat the foods that can actually stabilize the plaque, so that you can prevent the next heart attack. So rather than having unstable plaques, how you can stabilize the plaque. So that's why we are doing a Valentine's Day. So we are calling this as 5 days to a healthier heart, the ultimate Valentine's challenge. And in this challenge, we are actually going to show you how to prepare the foods. During this 5 days, you would be preparing the foods, and you can actually create a hearty meal for your Valentine. you can put together a meal based on like what you have learned during this 5 days. So when you look at cheeses are they're so rich in saturated fat. How can I enjoy my cheese without not having much saturated fat? So we will be showing you how you can have unsaturated cheeses, because technically what you're doing is you're plantifying them. Okay, so you are using healthy ingredients, you're using healthy plant-based ingredients to swap the unsaturated fatty acids. So that's why we are doing a 5-day challenge. And for this 5-day challenge, all you require is 15 to 30 minutes of your time every day for those 5 days. And we are running this challenge in our Facebook group. It's the Gift of Health Total Wellness group. And we will be posting this. So we will be sending an email. So like if you guys have not subscribed to our newsletter or our emails, make sure you subscribe. And Vanessa, if you can drop the link both in the YouTube and here, so that if people want to subscribe to our Healthy Heart newsletter and also to this challenge, so when we receive your emails, we will be sending you this. We'll be also sending this free PDF document that we shared today about fats that make your heart healthy. And also we are going to share the challenge recipe. So like you will get the recipe book, you will get the videos, and the fun part is we'll be doing this challenge together, where you will be learning how to make your cheese, whether it is blue cheese or regular cheese, like how you can still enjoy your pizza, how you can enjoy chocolate, because I know Valentine is coming, right? So that's where the chocolate, and we do want to enjoy chocolate for our Valentine. So we are going to show you how you can enjoy your chocolate this Valentine, and how you can make yummy Valentine treats, yummy Valentine brunches and suppers. So that would be amazing. So Sharon is asking, can I buy the recipe books to give for gifts? Sharon, guess what? When you join the challenge, you get it for free. Right? So join the challenge and get those recipe books for free, so that you can share with your family members or you're with friends, right? And you can also bring in your friends to join this challenge, so that like you can because when we have buddies, it's fun to do the challenge. Okay, so who is excited to do this Valentine's challenge, heart healthy Valentine's challenge? Okay, so good, amazing. Okay, so if you're wondering about the challenge, this challenge is beginning this Thursday, that is 13th Feb, and it is going from 13 to 17 Feb till Monday. So it's a 5-day challenge. It's going from 13th Feb to 17th Feb, which is Monday. Thursday till Monday. Okay, so I can't wait to see you guys in the challenge. And as I said, like we will be sending this to your emails, and if we have your emails, we'll be sending the free PDFs that we have shared in the talks here. So any questions before we wrap this up? You guys are good? Okay, so have a wonderful rest of the evening. And so if you make sure you watch this replay, so it is also available in our YouTube channel. Let's say if you need to listen to this lecture again, like you can definitely watch it there. Okay, so have a wonderful rest of the evening, and see you guys.